So a lot of neurology patients have sleep disorders. They're common in all patients, but especially in neurology patients. And I think that having neurologists become aware of and familiar with some easy behavioral manipulations that they can offer those patients is very helpful. So I know before I knew anything about sleep medicine, if a patient complained of insomnia or poor sleep quality, you sort of feel these palpitations, this feeling of dread, like, oh my gosh, not sleep, how am I going to deal with that? I might say something like, well, you need to get good sleep. But I didn't have any skills to actually help them be able to sleep better. And so my goal with this talk is to provide you with just a couple things that you can do. And, as a behavioral sleep medicine physician, obviously there's many things that I recommend to patients, but some of them are pretty easy, pretty simple. And that was what I wanted to let people know about. The ones that I think are most useful is something called sleep compression. So one thing that happens when people start sleeping poorly, when they have insomnia and they start worrying about their sleep, is that they end up spending a really long time in bed trying to make up for poor sleep quality, which of course is logical. You're sleeping poorly. They say, I want to make sure I have enough time to get the 8 hours of sleep. So I'm going to spend 10 hours in bed, but it actually just results in worsened sleep. It worsens the circadian system. It worsens the sleep-wake drive and causes all kinds of problems. So often with an insomnia patient, if you can just get them to, instead of spending 10 hours in bed, to spend 8 hours in bed or 7 hours in bed, you can improve their sleep a lot. And actually for patients over the age of about 30 who have insomnia complaints, really recommending a 7-hour in bed strict schedule with the same bedtime on weekends and weekdays, that can be really helpful. And then under 30, I typically do, 8 to 9 hours, but the exact amount is going to depend on what the patient is willing to do. The other thing, which I just said, but I'll emphasize again, is just having patients keep a regular schedule, even if they don't want to make any kind of time in bed manipulation. If you can just get them to wake up at the same time every day, especially the wake time is most important, that is going to do a ton. And there are many patients who complain of very poor sleep. And you actually look at their sleep pattern and, some nights they're going to bed at 10 and some nights they're going to bed at 2 and some days they're waking up at 6 and some days they're waking up at 10. And that results in a very weak circadian system and weak sleep-wake system and is poor quality sleep. And actually, even for people without sleep complaints, we know that keeping a regular schedule is one of the best things that you can do to improve your sleep quality. So this American idea of staying up later on weekends and sleeping in on weekends is one of many unhealthy lifestyle habits that we engage in America. You really want to have the same sleep schedule every day of the week. Other things, easy things that I talk about in the talk is stopping electronic screens for an hour before bed until wake time. The light emitted by our modern electronic screens is typically enriched for blue, the blue part of the color spectrum, which is interpreted by our brains as sunlight. And so if you are using those screens in the hour before bed or during the night, it really is, again, going to worsen the sleep quality, worsen that sleep-wake system. And it is very common for insomnia patients in the neurology clinic to just reach for, and for any clinic, to just be reaching for their phone at night when they can't sleep. Oh, I'm going to browse my phone. And just putting a stop to that one behavior, having the strict rule, charge the phone away from the bed or out of the room and put it away an hour before bedtime, that alone can make a huge difference as well. In the talk, I also provide some resources for stress anxiety reduction, which is a big issue. That's, in fact, often the primary issue when it comes to insomnia, is that the person is under stress, has a lot of anxiety. And nowadays, there's apps that can help with that a lot, like Calm and Headspace, or, of course, you can refer them to a psychologist. But recommending the Calm and Headspace apps to patients and kind of showing them how to use it can be very helpful. And I just want people to think about these things before they reach for a sleeping medication, because we have a tendency, the patient brings up their sleep complaint in the clinic, your heart is racing, what am I going to do? You can just give them a prescription and get them out of the clinic. But really, if you just maybe schedule them for another visit where you talk about their sleep and you get some of this information, you can usually get by without prescribing them any sleeping medication. And, you can try these things first. And that actually is the recommended treatment for insomnia. If you are for somebody with chronic insomnia, if you are reaching for a medication as the first treatment, that's actually not consistent with the guidelines for insomnia these days. Cognitive behavioral therapy for insomnia is the recommended first-line treatment. I also do provide them with some resources for how they can get their patients into cognitive behavioral therapy for insomnia.